Total joints are wonderful. I mean, I think of all procedures, the total hip is maybe the best procedure that ever happened. I mean, I do discectomies, I do fusions, I correct people's alignment, I take the little old man that's bent over at the grocery store and I make him straight. So as a absolute defining procedure where you change someone's life, that's my biggest procedure. But a total hip is the happiest procedure I do. I mean, people can say it's a carpal tunnel, but for me, a total hip is like a carpal tunnel. These are patients that walk in, cannot walk, pain the minute they get up, the minute they wake up and stand up, all of their pain is gone. It's a fantastic procedure. So I love doing totals. It relates so much to my spine simply because when people walk in, they'll have pain in their lower back, they'll have pain that runs down to their knee, or pain in their groin. And so it's mixed up a lot with whether they have spinal stenosis or whether they have a hip problem. Sometimes even a knee problem. You'll have pain in your hip that radiates down to your knee. So we've been taking care of these hip pain problems for years, but we've usually just given them to my partners. But now over time, we're just taking those back. The other thing that's so important to us is that if I fused your spine, it actually puts your pelvis in a position where you actually have problems if a total hip is done. And so having that knowledge of doing a fusion, it allows me to take a lot more care in how I position the total hip than I think the average doctor does.